Today we are good evening guys. Today we are deal about crush injuries. Okay, crush injuries. What will happen for due to some earthquake, tornadoes, and bombing, industrial accident? It will be happen. Recently, that Odisha train crossed, so it is and all a crush injury. It's a compression of the body parts causing to localized muscle and nerve damage. So it will be crush injury. It's mainly the upper extremities is 10% only. Lower is a 70%. It will be affected. Trunk is 9%. Crush syndrome and crush injury is this little different will be there. Crush syndrome is the maybe this question will come. Okay, what is the crush syndrome, like this they're asking. So you can normally you can write this. Okay, it's in a definition. So first recorded is a bombing of London during the fourth war. Then 5 people are crushed present to the shock and swollen in the extremities of the dark urine. Later that they due to renal failure they died. Okay. Then crush syndrome is localized crush injury with the systemic manifestation. It's effects of traumatic rhabdomyolysis. So it's called muscle breakdown. The release of the toxic muscles, cell components, and electrolytes is the circulatory system. So earthquake is 2 to 15% it will be happen. So 50% of the acute renal failure will be happen. Need to dialysis, then recur of fascinotomisis. It's a one kind of muscle injury only. Okay. Then components of the crush syndrome is local tissue injury will be there, organ dysfunction will be there, metabolic abnormalities will be there. So mainly that crush injury, what will happen when injury happen, that area ischemia will be there. So that the pain due to pain and not good have blood supply, that will be happen to necrosis. So necrosis form to prolonged pressure means that crush syndrome will come. Okay. So here what will happen, that fluid retention in extremities will be there, myoclopenia will be there, then metabolic abnormalities will be there. The secondary complication, compartment syndrome will be there. So it's due to cardiac arrhythmia and renal failure, hypotension, everything will come. This is a pathophysiological. Then metabolic abnormalities means acidosis. Acidosis means low pH level. Hyperkalemia means high potassium. Hypokalemia means low calcium level will be there. So metabolic changes. So definitive management of crush means mainly that we can restriction of fluid. Okay. So they're already for go for hypovolemic shock means that time we can use for only normal saline. Okay. Then secondary we are seeing that hyperkalemic will be there na, so we can give bicarbonate and everything. Then mannitol to renal failure will be occur na, so we can give mannitol to increase the output volume. Then goals of fluid therapy, prevent tubular precipitation to the myoglobin, decrease the risk of hyperkalemia, and correct the acidomia pH level and all we can correct. Then pre-hospital consideration in the management of the victim is crush injury, we can give O2 therapy. What are the treatment allotments? We can 4 hours we can send the patient to the hospital. We assess the neurological and vascular examination. So 1 or 2 liter we can give for normal saline before reach the hospital, because it will be occur to hypovolemic shock. Then we can consider to treat it when have severe bleeding in the low extremities. We can sometimes that amputation under will happen na, so we can tie to the tunicate. So maintain the IV fluid to initiate. Mainly patient deorientations and death will be it's go for. So here we can check the reperfusion symptom. So risk acute to deteriorations of the death, sudden release of pressure on the involved extremities. So reperfusion syndrome means acute hypovolemia and metabolic abnormalities. So here metabolic what will happen, that acidosis will be happen, so we can give sodium bicarb. Then hyperkalemia we can give calcium or sodium bicarb. Hypocalciemia we can give calcium. Then if you are 12 hours once we can hydrate to incident because of வந்து increase the chance of renal failure. Later treatment we can go for dialysis. Then compartment syndrome. So mainly we can compartment means it's a traumatic injury that muscle within the compartment can swell, causing to irreversible damage of nerves and vascular structure and muscles. So it's a medical emergency. Here everything will be nerve damage and vascular structure, muscles, everything here full muscle will happen. Then compartment of syndrome means it's considered to the possibility of compartment syndrome for all the patient significant of crush injury. That compartment of syndrome is reported to within 1 hour. The fracture is not mandatory of to develop. Okay, risk of alert means peripheral pulse we can check because mainly lower extremity 74% it will be affect, so we can check the peripheral pulse because patient will get early stage of ischemia. So in the upper means forearm and highest disc. Okay, for lower means anterior lateral and all we can check calf muscles and everything we can check. Then Phasiotomy is a 2 mark question. Okay, so this decision undertake to phasiotomy should be made based on the high index of suspension of compartment syndrome, the patient with complex extremity injuries. So the side of yearly phasiotomy they will do. Okay, then lower extremity phasiotomies means the they will do for some retraction, because anterior and lateral side and all it will be defect, so they can do for this one. Yearly mainly the patient excessive volume they will go for shock na, so we can prevent for hypovolemic hyperkalemia. We should yearly, it's a main causes of mortality, so mainly we can focus of hypovolemia and hyperkalemia. Then late mortality it will be multi organ failure and sepsis. Then factors importing of mortality and morbidity means severity of the crush and time of the treatment and initial treatment provide to the victim. So whenever that's why we can separate the triage and we can send the patient immediately. Who's the important we can finalize and we can send to the hospital to the patients. So when the train accidents, bomb blasting and all, it will be happen for earthquake. Na, that time and all, we can what are the injuries first, then depend time, then patient who is need immediate care. That and all victim you can see, analyze and think. Then you can send the patient. Okay, thank you guys. Bye. Take care.